Good morning and welcome back. Today we're going to talk about part 3, which are the behavior symptoms. The last time we spoke, we talked about the cognitive or the mental symptoms. So today we're going to talk about the behavior symptoms. And the behavior symptoms are as follows: aggression and anger, anxiety or agitation, delusions and or hallucinations, refusal, repetition or fixation on something, sexual inappropriateness, and wandering. So let's go through those real quickly. The aggression and the anger, depending on the type of dementia that your loved one has. Let's just say that they had some head trauma. The frontal lobe, or the front part, if they have frontal lobe dementia, that's where some aggression may present. They might just be a little aggravated for the littlest things. Maybe you moved their newspaper. So the aggression may present, or they just may be angry. But just remember that this is part of the disease. It's not that they're really angry, it's the disease causing the anger. Anxiety too. Anxiety about maybe there's a new caregiver coming into the home, about all the things that are going on, they're just not quite understanding, or maybe they're just coming home from a hospital stay and you've got occupational therapy there, physical therapy there, and a nurse, and all these different people coming into the home that get just anxious and agitated. Delusions and hallucinations, particularly with Lewy body dementia, your loved one may have hallucinations. These are real live things that are happening in their brain. Hallucinations are usually centered around the senses. They see something, they hear something, they feel something. They're all tied up with ropes, or somebody's trying to hurt them. They're usually centered around the senses. Very real, very live, and we've had people that we have taken care of with hallucinations. The best thing to do there is just to be in the moment with them. If they are seeing somebody or they're all tied up, untie them. It's very, very real to them. Refusal. Mom, time to get up. Nope. Time to take a bath. Nope. Time to take your medicines. Nope. Some days it's just going to be a no day. But you, knowing your loved one as you do, know how to hopefully stimulate them. If you say, oh Mom, the grandkids are coming today, you need to get up. Things that I love to do, like if her favorite time of the day or favorite meal is breakfast, just say, oh Mom, I got the coffee. Those types of things may help with those refusal, to get them to do the things that you need them to do. Repetition or fixation, there again, this is the disease. It just kind of, almost like a broken record. What time is it? What time is it? What time is it? What do I have to do today? So that would be a repetition. Sexual inappropriateness does happen as well. We have taken care of people, and there again, this is part of the disease. If these plaques and tangles, and I know I've not spoken about plaques and tangles, I will in the next segment. If they are destroying the brain, we all love affection, and sometimes that's just on go. So sexual inappropriateness can be part of this disease as well. The last part, or the last behavior symptom, is wandering, and this can be huge. I know that you have probably watched the news at night and have seen newscasters saying that, man 80-some years old is just lost. They left the house. Wandering can be for many different reasons. It could be as simple as needing to go to the bathroom and not knowing where. We are so regimented to time, we get up at a certain time. That just could be the need to go someplace, or be with someone, or go to work. So those are the behavior symptoms. So now we're going to talk a little bit about some techniques to help with those behavior symptoms. So one is seek to understand. Seek to understand means try to understand what's going on. Is it something emotional? Is it something physical? Is it something environmental? So seek to understand why maybe one of these behaviors is erupting. Maybe they just have a toothache and can't express that. Redirect is another technique to minimize symptoms. Redirect sometimes just really literally means redirecting. That could be redirecting the conversation, or if your loved one is heading out the front door, ask them where they're going. Offer choices. If you're helping with your loved one getting dressed, you know, a mom's got a huge walk-in closet. So something not to do would be, Mom, what would you like to wear? And have dozens of choices, you know. Offer her, Mom, do you want to wear the pink blouse or the blue blouse? Still making that choice makes them feel like they're still in control. Apologize. I can't emphasize that enough. I'm sorry. I'm so sorry. It just will help, hopefully, to minimize, especially if they're frustrated and they've done something. I'm sorry you're having a bad day. I'm sorry you feel that way. You're right, Mom. You know, just apologize. Try 3 things 3 different ways. That's another tip. Maybe you need to redirect. Maybe you need to apologize, offer choices, and be proactive. Those, again, are the behavior symptoms and hopefully some techniques. I will see you next time.